what happened?
I don't know, man.
Why are you so sore?
I think it's because I worked out yesterday.
Oh, maybe you have DOMS.
DOMS? What's that?
Oh, it's delayed onset muscle soreness. Watch this video to find out.
Delayed onset muscle soreness is a type of muscle pain and stiffness that occurs after unaccustomed or strenuous exercise. It typically manifests as 12 to 24 hours after the activity and peaks around 24 to 72 hours post-exercise. The soreness is the result of microscopic damage to the muscle fibers and is associated to the inflammation as the body repairs the tissue. DOMS can last from 3 to 5 days, during which the discomfort gradually subsides as the muscle recovers.
You might be wondering exactly how DOMS come about, so here's a quick explanation. High-intensity exercise such as strength training can cause microscopic tears in your skeletal muscle, as they are directly involved in voluntary movements. These microtraumas most commonly arise from the eccentric contraction, or the lengthening of the muscle under tension. This may look like the controlled downwards movement of a bicep curl, like this, or the slow lowering of the body during a push-up. But what causes the pain? Microscopic tears from eccentric contractions trigger the inflammatory response within musculoskeletal cells, as our body's way of increasing blood flow to the injured site. This is important for muscle repair, but can cause soreness in the area. We'll elaborate further on this later.
DOMS manifests as a range of observable symptoms such as temporary mechanical hyperalgesia, which is pain during static or dynamic stretching, especially when muscles become contracted or tight. Muscles feel tender to the touch, which occurs when nociceptors are damaged. Reduced range of motion and flexibility, stiffness when moving, temporary reduced muscle strength, and swelling of muscles. DOMS also has histopathological symptoms, which includes swelling of musculoskeletal cells, loss of intermediate filament proteins, desmin and dystrophin, which are located between the sarcolemma and the myofilaments, infiltration of inflammatory cells, and the change in neutrophil concentrations.
So can you still exercise with DOMS? Yes, but it is recommended to rest as much as possible and stick to low-intensity activities like swimming or cycling. Foam rolling is a good recovery method, helping reduce muscle soreness, improve range of motion, and increase overall blood flow. Stretching and tissue flossing are also effective, targeting muscle tension and enhanced flexibility, which together promote quicker muscle repair and overall recovery.
Moving on to treatments, there are 6 main treatments that can help reduce DOMS, including heat and cold treatment, massages, and more. Heat treatment or heat therapy dilates your blood vessels, promoting circulation, which increases oxygen delivery and lactic acid removal. Common heat therapy treatments such as saunas have been proven to reduce DOMS by 47%. Concurrently, cryotherapy or cold therapy reduces blood flow to an injury site, slowing down the process of inflammation, swelling, and tissue damage. Applying an ice pack or cold compress, or even a full-body cryotherapy session within 48 hours of the exercise is most effective. Moreover, alternating cold and heat therapy, which is applying ice for 20 minutes and then heat for 15 minutes, produces a similar effect to pulsing compression therapy by vasoconstriction than vasodilation right after. As for massaging, it helps to flush out lactic acid and treats DOMS by relieving pain and stiffness. Just like heat therapy, massaging helps increase the blood flow in the muscles, reducing inflammation, which allows muscles to relax and reduce tension. Similarly, for compression garments or clothing, multiple studies have shown that compression garments after an exercise will hugely reduce the feelings of soreness, since the compression reduces the space available for swelling as well as improving venous return and circulation. Contrary to the above methods, analgesic drugs are pain relievers that help with the management and treatment of pain, but not DOMS itself. Common analgesic drugs include acetaminophen and ibuprofen. You should only take these drugs after consulting a doctor, and remember to not overdose as it can interfere with muscle repair. Last but not least, myofascial release focuses on relieving muscle shortness and tightness, and especially the tension in the muscle's connective tissue. This is done by foam rolling or massage by the therapist. The difference between myofascial release and massage is that massages feel good for a short term of time, but myofascial release stretches the fascia over the muscles, which is much more effective and long term.
There are a variety of ways that we can prevent or minimize the risk of DOMS from occurring, and they can be easily included either before, during, or after a workout. Firstly, warm-up is crucial to prevent DOMS. Dynamic stretching before a workout can increase blood flow to muscles and warm them up in preparation for intense exercise, reducing the risk of injury. Gradual progression involves slowly increasing the intensity, duration, and frequency of an exercise. This is important to keep in mind when exercising, as it will allow muscles to adapt and avoid sudden increases in weight, which may cause tears in microfibers. Before, during, and after the workout, it is most important to stay hydrated. whether that be with water, hydrolyte, or drinks with electrolytes. Drinking water will help prevent muscle cramps and aid in muscle recovery, easing the soreness from DOMS. Post-workout, cooling down and decreasing the intensity can reduce or flush out lactic acid, as well as reduce muscle tension and stiffness, lowering the risk of tearing a muscle. Furthermore, hydration and diet must not be neglected. A balanced diet in proteins, carbs, and healthy fats will assist in fueling muscles throughout the workout. Consuming protein and carbohydrates after a workout can significantly aid muscle repair and reduce soreness, minimizing the effects of DOMS. These steps and strategies are easy ways that you can minimize the effects or reduce DOMS entirely.
What's the difference between DOMS and acute muscle soreness? DOMS is often confused with another similar process called acute muscle soreness. Acute muscle soreness occurs during the exercise from lactic acid buildup. This is because high-intensity exercise often uses the lactic acid energy system, which is a byproduct of lactic acid. This accumulation of lactic acid inside the skeletal muscle causes a burning sensation. DOMS, on the other hand, does not involve lactic acid in the process at all.
You get it now?
DOMS.